Good morning, everyone. I'm Rosina Grosso, and welcome to the second season of the Red Chair series, sponsored by Mainline Health and the American Heart Association. Today, I'll be speaking with Dr. Katie Hawthorne, a non-invasive cardiologist at Lankanaugh Heart Institute. Dr. Hawthorne specializes in consultative and preventative cardiology, with a focus on women's cardiovascular care and advanced cardiac imaging with structural heart conditions. Dr. Hawthorne is an expert in cardio-obstetrics, providing care for women before, during, and after pregnancy, particularly those managing cardiovascular risks related to pregnancy complications. With her personalized approach, she empowers patients to take control of their heart health at every stage of life. Welcome, Dr. Hawthorne, and thank you for being with us today.
Thank you so much for having me.
So, Doctor, I would love for you to let us know what type of cardiologist you are and what type of patient you treat.
So I am a non-invasive cardiologist, meaning I don't perform invasive procedures, but I really cover a wide breadth of patient care. And as you mentioned, I focus on women's cardiovascular care, largely with my obstetric practice through pregnancy and then long-term.
Can you explain what spontaneous coronary artery dissection is and how it differs from a traditional heart attack?
Sure. So to just step back and think about a heart attack in a traditional sense, there's generally plaque inside the blood vessel itself, coronary atherosclerosis or plaque buildup we may hear about, and a blood clot forms on that plaque. It obstructs blood flow, and then that heart tissue can die if we don't intervene and open up that blood vessel. Spontaneous coronary artery dissection, or SCAD, is a different type of heart attack, and it's actually a tear within the vessel itself that can obstruct flow as a blood clot forms behind that tear. And what's really unique about spontaneous coronary artery dissection, in just as it can spontaneously form, it often spontaneously goes away. But it is a very serious condition that can lead to a heart attack.
And we have to keep an eye on it. What are the common symptoms of SCAD, and why are they often overlooked or misdiagnosed?
So symptoms of SCAD are going to be just like the symptoms of a heart attack. Most patients are going to experience chest pain. And why are they overlooked? It's because of the population. So unfortunately, spontaneous coronary artery dissection occurs most commonly in young women, often between age of 44 and 55. So if they come into the emergency room, heart attack may not be the first thing that we think about.
And why does the tear happen?
We don't know. One of the concerning things about dissection is we don't always know why it happens. We see them in women with hormonal changes. So it is actually the most common cause of heart attack in pregnancy. So we know that there may be some underlying hormonal predisposition, but that's not the whole story. Sometimes we see it with extreme exercise, and especially in men, but we can see it with extreme emotional distress. So sometimes if something really tragic happens. And then there are some genetic factors that can come into play. We don't have it all figured out. We know some things, but not enough.
And how is SCAD typically diagnosed? And what are the current treatment options?
So diagnosis gold standard is with a coronary angiogram or a catheterization, where we go into the cath lab. We actually look at the blood vessels with injecting dye and a fancy x-ray camera. And that's how we do diagnose traditional heart attacks as well. Now, the tricky thing about treatment is different. So with a traditional heart attack, you want to open up that blood vessel, put a stent in. With dissection, really, we don't like to touch them. So we know that the human body can heal that blood vessel better than our stents can. And actually, if you put a stent in with a dissection, you may end up in trouble because there's a tear, you may make that tear worse. Now, of course, if the patient is very, very sick, we may need to put a stent in or do bypass surgery, but that's not our first line like it is for a traditional heart attack.
Could the tear get worse on its own?
It can, and that's another reason why we do keep patients in the hospital a little bit longer. The tear can propagate or go a little bit further down. The other thing is, unfortunately, once you have a dissection, you are at risk of having another dissection, sometimes even in a totally different blood vessel.
So what does recovery look like from SCAD, and what emotional or physical steps can patients take to heal and reduce their risk of recurrence?
Many of my patients with SCAD will have an ongoing fear that another dissection will come. Again, they were a healthy person who had no medical problems and had this major event happen, had a heart attack. We have a wonderful support group through our Women's Heart Initiative. I always encourage my patients to join the support group. I think talking with other women, even if it's not the same, but have some similar experiences is very important. We know there's some literature to suggest beta blockers long-term may help reduce recurrence. Hopefully down the road we'll learn more about why SCAD happens and have different treatment strategies.
And that's why research is so important.
So important.
What is the most important advice you give your patients, particularly women, about protecting their heart health and managing cardiovascular risks?
If they're feeling something that's not right, get it checked out, see a doctor. If that person is not addressing your concerns, seek a second opinion. It's so important we listen to ourselves. We know our bodies better than anyone else. And taking good care of it, finding the time to exercise, go along with the AHA's Essential 8. Check off those marks of your exercise, your sleep, your healthy diet, not smoking, doing the right things to take care of your body. I talk about lifestyle all the time with my patients. It's really so important for cardiovascular health, just as important as any of the medications I'm giving them.
And the easiest place to find that information of the Essential 8 and the best exercises to be able to do is just to go to the American Heart Association website, and you'll find all the information there. Thank you, Dr. Hawthorne. It was so wonderful to be with you. Thank you for all of your information and your dedication to heart health. And thank you all for joining us. We'll see you next time on the Red Chair series, sponsored by Mainline Health and the American Heart Association.